I sat in a 26-hour hearing on the big ugly bill as we saw our Republican colleagues claiming that they were just trying to make health care available for everyone and strengthen the system. Yet they did absolutely nothing to address the actual underlying costs and the reasons that costs are increasing for health care and just about everything else, from energy bills to groceries. They did nothing to fix that. Instead, they put draconian paperwork requirements in place that other states have proven will kick people off of their health insurance. They put cuts to Medicaid that will, as you've already heard, hurt our rural hospitals, but they'll also hurt our urban and suburban hospitals. I was a member of the state Senate when we expanded Medicaid, and I also carried the bill to create the Virginia Healthcare Exchange. And the reason we did both, just like the reason the Affordable Care Act was passed in the first place, was because we understood that costs go down when the uninsured rate goes down. The more people who have access to health insurance, the more likely they are to get the care they need before it's too late or before it is too expensive, to get the primary care and focus on wellness. And yet, with this bill, so many people will not be able to afford health insurance or will lose it altogether, over 15 million people. But they'll still get sick. And instead of going and getting their primary care or going when something first feels wrong, they'll show up in the emergency room when it may be too late and it's definitely more expensive to treat. And if they're uninsured and they can't pay that bill, the rest of us pay for it. But this bill also hurts our clinics. During the recess, I traveled not just in my district, but all across Virginia to talk to providers and patients about their fears. I visited a dental clinic out in Abingdon. Before this dental clinic opened, and 80% of their patients are on Medicaid, but before this dental clinic opened, people had to wait once a year for the Ram Clinic in Wise County to come and get their basic dental needs. And yet this clinic now is worried, how are they going to keep the doors open because of these cuts and because of people losing their insurance through both the Affordable Care Act because they can't afford it and through the cuts to Medicaid. I want to point out one other thing. I sat in another hearing where Secretary of Health Robert Kennedy Jr. talked about everything that the administration wanted to do to make America healthy again. And I couldn't help but notice a huge disconnect between the words coming out of his mouth and the actions coming out of the Trump administration and congressional Republicans. Because it's not just stripping people of their health insurance, but it's stripping people of food assistance, the same population, in a way that not only impacts individuals and families, but impacts child nutrition programs and impacts rural grocery stores. And so we already had healthcare deserts and food deserts, and the big ugly bill is going to make that worse. And once the enhanced premium tax credits on the ACA expire, it's going to be even worse again. And so I join my Democratic colleagues. There is legislation pending from Democrats that would extend the premiums permanently, that would undo these draconian cuts to both SNAP and Medicaid, because people elected us to help them, to lower costs, to close healthcare deserts, to make sure that everyone, whether they are rural, urban, or suburban, no matter who they voted for, knows that if they get sick, they can get the care they need and not go bankrupt. And under the big ugly bill and congressional Republican inaction, that's not going to happen.